Hi, my name's Dr. James Cruz. I'm a consultant microbiologist in Liverpool, and I work to support the clinical teams at Clatterbridge Cancer Centre. This week is World Antimicrobial Resistance Awareness Week, which is a global campaign to improve awareness of antimicrobial resistance, organisms' resistance to effective treatments. And when we try and use therapies to treat infections, they find ways to um, survive. It's important because bacteria and other pathogens kill people. When you're using antibiotics, you need to make sure that you're using them appropriately, because as an unintended consequence, bacteria can develop or acquire resistance mechanisms that render the antibiotic ineffective. And not only do these bacteria develop and exist, but they can also spread from, unfortunately, from patient to patient or from environment to patient as well. So if we're not using antibiotics optimally, there is an increased risk that in future generations, those same antibiotics might not be effective. It's all given this term, which is coined as antimicrobial stewardship. And essentially what that means is optimal use of antibiotics. And there are a number of different strategies to optimize antibiotic use. That is making sure that patients are given the right antibiotic when they come into hospital. When an alternative diagnosis is made, or when patients improve, antibiotics are either stopped or given orally. And the shortest course, we review antimicrobial prescriptions throughout the week, making sure that they're appropriate. Where additional antibiotics are required, we advise those, and we aim to try and get patients on oral antibiotics at the earliest possible opportunity, which means that nursing time is saved from having to set up IV antibiotics, and that patients can get home quicker.